So we talked about the normal function of skin and skin disorders. We're going to continue with the skin disorders, but we're focusing on the area of skin infections and tumors. So I'm trying to do my lectures with the timer on so I don't get all crazy and take up a bunch of time, but we'll see how it goes with this one. So skin infections can be caused by bacteria, viruses, fungi, or other types of microbes and parasites, just like any infections. They're often caused by opportunistic microbes from minor abrasions or cuts, and they can develop into serious and systemic infections. The causative organism needs to be identified for the appropriate treatment. So we can say, oh, wow, that's infected, but by what? And what is that thing sensitive to is the relevant information. So I will never forget a question on my board exam, and I'll also never know if I got the thing right. And it showed a picture of a wound. There's the picture, and it just said, what can you assume from looking at this wound? Or which one of these things is the best assumption looking at this wound, or something like that. And I looked at it, and I looked at it, and I looked at it, and they actually all seemed right. They all seemed like good answers, and so I marked it, and I went back and I answered the other questions, and I came back to it, and then I just did my best guess, and no one will ever know if I got it right. I mean, the FSBPT, but that's how it is on the board exam. But there are skin questions on the board exam is what my whole point is. Bacterial infections are common on the skin, and the primary infections are often caused by our lovely resident flora. Secondary infections can develop in wounds or in pruritic lesions. So cellulitis, oh my gosh, you see so many people in the hospital with cellulitis. Erysipelas is the medical name for cellulitis. It's an infection of the dermis and subcutaneous tissue, and it's usually secondary to something else, often an injury. Maybe iatrogenic, meaning it was caused by some other medical treatment. The causative organisms are usually Staphylococcus aureus. Okay, now we're getting into an area we know Staphylococcus aureus frequently has multi-drug resistances. So it could be MRSA, it could be something else. Sometimes Streptococcus, different types of Streptococcus are the causative organisms for cellulitis. You frequently see it in the lower trunks and legs. Especially in individuals with restricted circulation in the extremities and immunocompromised individuals. The area is red, swollen, and painful. And red streaks might develop running along lymph vessels proximal to the infected area. Once you see someone with cellulitis, you know it's cellulitis. And usually you see that person in the hospital, and they are being treated with IV antibiotic infusions. It could be life-threatening cellulitis. Furuncles, which I think is a fantastic name, it's another word for boils. They're usually caused by our friendly neighborhood Staphylococcus aureus, beginning at the hair follicles in the face, back, and neck. And they frequently drain large amounts of pus, purulent exudate. A lot of times they're caused by auto-inoculation, which is squeezing of the boils resulting in spread of the infection to other areas of the skin. So when you have skin lesions, don't mess with them. I guess that's the takeaway on that. Carbuncles are which is another great word, a collection of furuncles that coalesce to form a large infected mass. So this thing on this person's foot is a carbuncle. Yikes, right? So they're treated with compresses to promote drainage, analgesics to provide pain relief, and sometimes if it gets big, they have to cut and drain abscesses, and antibiotics are needed in that case. Impetigo is a common infection in infants and children, but it may also occur in adults. It's our friendly neighborhood Staphylococcus aureus, which is highly contagious in newborn children. Lesions are commonly on the face, and transmission may occur through close physical contact or through fomites. So the little kids are at preschool or whatever, one of them has it and wipes their face on anything because kids wipe their faces or wipe things on their faces, and then another kid picks it up and you've got it. Pruritus is common, leading to scratching and further spread of the infection. So there's a picture in the book of a cute little infant's face with impetigo. Oh, here it is. In the early stages, I really should look at my PowerPoints. I mean, I do, but here you go. Here's that picture. Topical antibiotics are used to treat in early stages, and systemic antibiotics are used if lesions are extensive. There, of course, as we know, are antibiotic-resistant strains of Staphylococcus aureus, and 25% of the people in the community have those now. And so you can get local outbreaks of infection because the antibiotics aren't working. This is bad news, people. Acute necrotizing fasciitis is bad. This is the flesh-eating bacteria sort of thing. There's a company, and usually you can get it at like the Pacific Science Center and the Science Center in Vancouver. They have these little stuffed animals that are called giant microbes. I have the Staphylococcus aureus that causes necrotizing fasciitis giant microbe, just for fun. Anyway, if you like that sort of thing. But I digress. Acute necrotizing fasciitis is a mix of aerobic and anaerobic bacteria, usually at a site of infection. There is severe inflammation and tissue necrosis, which can kill you. It's usually caused by a super virulent strain of gram-positive group A beta-hemolytic streptococcus. Bacteria secrete toxins that break down fascia and connective tissue, causing massive tissue destruction. There's often a history of minor trauma or infection in the skin and the subcutaneous tissue of an extremity. So if there is a delay in treatment, you lose more tissue. You could potentially have amputations and a high probability of mortality. So this needs to be treated ASAP. Systemic toxicity can also develop with fever, tachycardia, which is a fast heart rate, hypotension, low blood pressure, mental confusion, disorientation, and possible organ failure. So serious stuff here. It needs aggressive antimicrobial therapy and fluid replacement. This person needs to be in the hospital. They have to excise all the infective tissue, and it frequently results in amputations. And they need a lot of times hyperbaric treatment, high oxygen flow and hyperbaric chamber. So in the wound care facility that we have in Bellingham, which is part of the same hospital that I work for, they have hyperbaric chambers for wound treatment. Leprosy, which is also known as Hansen's disease, is caused by a bacteria. It's caused by Mycobacterium leprae. It's a chronic disease, and it's classified into 3 major types. The clinical signs and symptoms vary depending on the type, and it generally affects skin, mucous membranes, and peripheral nerves. The damage can lead to loss of limbs. The mechanism of the pathogenicity of that bacterium is largely unknown. It's diagnosed by a microscopic examination of a skin biopsy, and the treatment is primarily with antibiotics. So we were talking about bacterial infections, and you could also get viral infections of the skin. Herpes simplex type 1 is the most common cause of cold sores or fever blisters. Herpes simplex type 2 is the cause of genital herpes. Both types of herpes simplex virus cause similar effects, just in different areas. The primary infection may be asymptomatic, and just like chickenpox, the virus remains latent in sensory nerve ganglia. And recurrence may be triggered by a cold, a common cold, sun exposure, or stress. So you never really get rid of it, you just treat it. There are new antivirals that they use to treat herpes out there. So again, they're always coming up with new treatments. So if you have something, make sure you see, or you know somebody that has something, make sure they see a dermatologist. Herpes simplex is spread by contact with fluid from the lesion. Spread of the infection to others is possible prior to the appearance of lesions. So just because you don't have lesions doesn't mean you can't spread it. So the potential complications involve spreading of the virus to the eye, which is called keratitis, and herpetic whitlow, which is a painful infection of the fingers. So this shows the evolution of the virus. That's in the text. It's spread by, we already looked at this one. Okay, Verrucae, or warts, are caused by human papillomavirus, types 1 to 4. Human papillomavirus, another type, is also the one that causes cervical cancer. There is a vaccine for this. So it frequently develops in children and young adults. Plantar warts are common. So they're warts on the bottoms of your feet, on the plantar surfaces of your feet. It spreads by viral shedding of the skin surface, and it may resolve spontaneously with time. Genital warts are caused by HPV type 6 and 11. I believe cervical cancer is caused by HPV type 5. So fungal infections, are also known as mycoses, are superficial, most of them. Candida infection, candida is yeast, is associated with diabetes. Yeast like sugar, there's more sugar in your blood. There you go. It may spread systemically in immunocompromised individuals, and it's diagnosed from skin scrapings. Skin scrapings from fungal infections become fluorescent in ultraviolet light, and you can see that under microscopic examination. And they will also culture these samples in fungal-specific media. Tinea is a common infection. There's Tinea capitis, which is infection of the scalp, and Tinea corporis, which is infection of the body, particularly non-hairy parts of the body. The Tinea capitis is common in school-age children. Erythema, which is redness, might be present. An oral antifungal medication is used to treat it. The infection of the body, Tinea corporis, is a round lesion with a clear center. They call it ringworm. Pruritus, itchiness, might be present, and it's treated with topical antifungals. Tinea pedis, also known as athlete's foot, involves the feet, particularly the toes. May be associated with swimming pools and gymnasiums. That's why you want to wear slippers or, shoes, shower shoes when you go in the gym. May be part of normal flora that becomes opportunistic. You can get a secondary bacterial infection from athlete's foot, and it's treated with topical antifungal medication. Tinea unguium is infection of the nails, particularly the toenails. The nails turn white and then brown, and the nail thickens and cracks. And the infection tends to spread to other nails. This is your classic athlete's foot. The topical antifungals in there is an oral antifungal that they use to treat the nail infection. They're very effective. So those are treatable. Other infections, scabies, nobody's favorite. It's a mite called Scarpotes scabii. The females burrow into your epidermis and lay eggs over a period of several weeks. If that's not creepy, I don't know what is. The male dies after fertilizing the female, and the female dies after laying the eggs. And the larvae migrate to the skin surface. They burrow into the skin in search of nutrients, and just talking about them makes you feel itchy. But they are intensely itchy. The larvae mature, and then the cycle is repeated, and it appears on the skin as tiny brown lines. Icky. Lice, another icky infection. Pedeculus humanus corporis is the body louse. Pedeculus humanus capitis is the head louse. And Pedeculus humanus pubis is the pubic louse. Female lice lay eggs on hair shafts. After hatching, the louse bites the human host and sucks their blood to produce another egg. And you can get excoriations, which is, worsening, resulting from scratching. Ugh. Oh, well, I'm so happy to move on to skin tumors at this point. Keratoses are benign lesions usually associated with aging or skin damage. Seborrheic keratoses are proliferation of basal cells that lead to oval elevations on the skin, which may be smooth or rough. Actinic keratoses on skin exposed to ultraviolet radiation, also known as sunlight, commonly in fair-skinned persons, and the lesion appears as a pigmented scaly patch. So the warning signs of skin cancer, these are good to know. A sore that doesn't heal, the change in shape, size, color, or texture of a lesion, especially an expanding irregular circumference or surface. New moles or odd-shaped lesions that develop. A skin lesion that bleeds repeatedly, oozes fluid, or itches. So see your dermatologist. So to reduce the risk of skin cancers, you want to reduce sun exposure at midday and early afternoon. Cover up with clothing or remain in the shade. Wear a broad-brimmed hat to protect face and neck. So when I was just out walking, I was wearing my broad-brimmed hat, my sunglasses, and I had a long-sleeved light jacket on to protect my arms. And I had long pants too. So I'm serious about skin cancer. Applying sunscreen or sunblock and protecting infants and children from exposure and sun damage to skin. Squamous cell carcinoma is a painless malignant tumor of the epidermis. Malignant being the key word here. The lesions are most commonly found on exposed areas of the skin, but also in the oral cavity. So you'll get it on the face and neck or the base of the tongue. There is an excellent prognosis for this when the lesion is removed within a reasonable amount of time. There is an invasive type that arises from the pre-malignant condition. Malignant melanoma is the dangerous one that can kill you. Highly metastatic form of skin cancer. It develops in melanocytes, that's why it's called a melanoma, from a nevus, otherwise known as a mole. So they often appear as a multicolored lesion with an irregular border. They grow quickly and they change in shape, color, size, and texture, and they may bleed. It's treated by surgical removal and radiation plus chemotherapy. Serious. So here are the ABCD of melanoma. Melanoma is suspected in a nevus that shows a change in appearance, change in border, change in color, or an increase in diameter. That's the ABCD of melanoma. That would be a good little mnemonic to know. Kaposi sarcoma usually occurs in people with suppressed immune systems or immune deficient, and people in AIDS. It's common in people with AIDS. It may affect the viscera as well as the skin. Malignant cells arise from the endothelium in small blood vessels, so you get purplish, non-pruritic macules, and they're non-painful. So in immunocompromised patients, lesions develop rapidly all over the body, and they're treated by a combination of radiation, chemotherapy, surgery, and biological therapy. So immunodeficiency is dangerous because a lot of these things develop that when your immune system doesn't work properly.